So some of our alumni that have gone through our criminal justice program. So we're here to kind of talk about reform in action and the intersection of these three different fields. I'm going to turn this over to Professor Vertel Martin, who's going to be moderating the session today. And then please feel free to add in any questions you have in the chat. We'll kind of keep an eye on that and save at least 15 minutes for that at the end.
Okay, welcome panelists, and thank you for taking the time out of your extremely busy schedules to participate in this panel discussion on reform in action, breaking the stigmas of mental health, addiction, and crime. The focus, of course, will be on the intersection of the three fields, criminal justice, social work, and psychology, and how we can best serve our citizens. As experts in the field, we're going to ask questions that are intended to have you share your experiences and give your real world examples. And we're going to focus, of course, on what changes are needed to engage in reform. So first, I'd like you all, we have 7 panelists, esteemed panelists. So I'd like you all to take your turn to introduce yourselves. I'll start off with I call you Dr. Chief Kott, as well as assistant, as well as adjunct professor for Northampton Community College. Can you tell us a little about yourself?
My most important title is Mom. Hi, I'm Michelle Kott. I'm the Chief of Police with the City of Bethlehem Police Department. I also received my doctorate in criminal justice from California University of Pennsylvania. And as Vertel said, I also, something that, I'm very passionate about is teaching. That's what I want to do when I grow up. So after I'm done being a police officer, I'm really hoping that I can continue teaching in the criminal justice field. So I'm an adjunct with Northampton Community College as well. Mom to a 6- and a 3-year-old. I'm not originally from the Lehigh Valley. I'm actually from a little bit northern in Schuylkill County, McAdoo, but came down here for college at DeSales University, where I ended up doing my internship at the City of Bethlehem Police Department, and they weren't able to get rid of me. So I am very excited, stoked to be here to talk about all the good things that can come through collaboration.
Thank you. And I'm not going in any particular order, so I'm just going to call on Mr. Jordan Westerman.
That's me.
I apologize, Ms.
It's okay.
I apologize.
No problem. I work alongside Chief Kott. I'm the social worker that when we talk about our pilot program that we're doing with social work and police, I work alongside Chief Kott. I have my master's in social work. I graduated from Kutztown University in 2018. My most important title is also Mom. I have 2 little ones. My daughter, she's an angel, and my son, I'm not sure. He's 18 months, lots of fun. But I've been with the City of Bethlehem for 3 years now, and I'm really excited about some of the things that we're doing here in the police department with social work. So I'm excited to talk about that today.
And we're just as excited to hear about that. And again, I apologize. Brian Sabo.
Hello, everyone. My name is Brian Sabo. I'm a person in long-term recovery. I am a certified recovery specialist and a certified family recovery specialist. I am the program director of a recovery resource center, one of 5 that Northampton County funds, called the Hope Center, located in Bethlehem, Pennsylvania. And one of my passions, and I guess I'll talk about this later on, is breaking the stigma of addiction. Thank you.
A worthy passion indeed. Wilberto Sicard, and I hope I'm saying that right. I apologize if I'm not.
That's correct. Thank you so much. Thank you, Katrina, for putting this together. And thank you, everyone, for being here today. My name is Wilberto Sicard. You can all just call me Berto. I am an organizer with CACLV's Campaign for Racial and Ethnic Justice. I graduated from William Allen High School in 2016, and I got my bachelor's from Lehigh University with double majors in history and Africana studies. I wrote a senior thesis on residential segregation in Allentown and how that's led to an unequal public school system in the city. I will be attending law school at Yale Law School next fall. I'll be graduating in 2024 with my primary goal of working to reimagine the criminal justice system in the Lehigh Valley. In addition to my work at CACLV, I also am the vice president of the Lehigh Valley Justice Institute's board of directors. So thank you all for being here, and I'm excited for today's conversation.
And thank you, and impressive credentials indeed. Next we have Detective Corporal Alfred Johnson, former NCC student.
Good morning, everyone. As Professor Martin said, I'm Detective Alfred Johnson, a 2011 graduate of Northampton Community College. I then transferred to Westchester University of Pennsylvania, where I received my bachelor's in 2012 August, and then my first master's in criminal justice in 2013. My research focus was on the exclusionary rule. I then moved to Delaware, got brief employment, and then by 2014, March 2014, I joined the Prince George County Police Department, graduated from the academy in 2014, October, became a police officer. I'm currently, then I went back to school, American University of Washington, D.C., and got my second master's in public administration and policy. I'm currently a detective. I've been with the department for 7 years. Part of my responsibility is to investigate attempted murders, first and second degree assault, and multiple property crimes. I've been happy to be on this panel. It's a wonderful opportunity to return and share my knowledge with current students.
Thank you, sir. Making me proud. All right, another NCC alumni, Justin Ortiz.
Hey everyone, my name is Justin Ortiz. I'm originally from Brooklyn, New York. I moved up here in high school, and I attended NCC for a criminal justice degree, or my associates in criminal justice. And then after that, Ms. Vertel Martin, kind of pushed me to ESU to attain a social work degree. So I got my bachelor's in social work from ESU. After that, I started working for Pocono Services for Families and Children. I was a family advocate, and we expanded over the course of a couple of years, and now I'm a director. And we focus on birth to career services, as well as the wraparound approach to trying to help support the families with their evolving needs, and provide supportive efforts for them to meet their goals. So I love what I do. We're very in touch with the community. I'm also part of the Community Service Administrators Board of Monroe County and Pike County. I'm part of the Pennsylvania Statewide Youth Development Network's Quality Committee, and I'm also the chairman of the Octel Governing Board of Pennsylvania. So I'm very in touch with supportive efforts to help families meet their goals. I'm also a MANT trainer for the MANT system, and what that is it teaches relational, conceptual, and technical skills for de-escalation, and also trauma-informed approaches.
Wow, I think I can retire now. Dr. Chief Kott will take my spot when she's ready, and then I can just sit back and watch my students soar in their careers and make a difference in our society. And lastly, but not least, we have my colleague, Dr. Hanif Bey, who has joined us here today. Dr. Hanif.
Good morning, everyone. I just want to first say thank you to Northampton Community College for sponsoring this very timely event. Obviously to Professor Vertel Martin, also to Katrina and all the organizers of this event, and especially to the panelists as well. Thank you. And then most importantly to the students who are watching and listening to this event as well. And I would be remiss for not acknowledging Professor Hope Horowitz, who was my professor in my master's degree as well. So basically, I'll keep it short. I've been working as a social social worker now for 31 years. As you can tell by my accent, I'm from the Bronx. And so as a result of that, I moved up here with a family, father, husband of 3 children, 3 daughters, a lot older than I thought. And then in terms of, my experiences, they vary from being a child sexual abuse worker back in the 80s. And now for the last 15 years as a hospital social worker as well, and 6 years as a adjunct faculty at East Stroudsburg University's Department of Sociology, Social Work, and Criminal Justice. So it's an honor and privilege to be here. Thank you.
And we're honored and privileged to have you on our panel, Dr. Hanif. Okay, that being said, I also want to welcome all of our attendees today, and I see we have quite the array of students, staff, and faculty, so thank you very much for coming. And so I'm just going to jump right into the first question, which is a little bit of a curveball. I know we sent you questions ahead of time, but I would be remiss if I didn't ask, in light of the Derek Chauvin verdict, in your experience, how might the situation with Mr. George Floyd have been handled differently as it relates to the intersection of law enforcement, social work, and psychological services? Any thoughts on that?
Do you want us just to talk or raise my hand or?
Yeah, that's a good question. Just talk.
Okay, I didn't want to be rude. Well, the first thing that comes to mind is time. One of the most important things you can do when dealing with someone who may be in crisis, or anytime, the police initially arrive at a location and could be upsetting to people, is slow things down, take some time. It seems to me from the videos that I saw of the incident, they quickly wanted to get Mr. Floyd in the back of the vehicle. And then once he was trying to explain that he was claustrophobic, that, he was having trouble breathing, that he didn't want to go into the back of the vehicle, then it turned into, okay, we got to rip him out of the vehicle. We got to get him on the ground. We have to hold him there. And it just seems like the officers were in a rush, perhaps calming down, giving more verbal instruction, trying to talk to him rather than taking those physical actions. Off the top of my head, that's the very first thing that I think could have resulted in a different outcome, is slowing things down.
Yes, and certainly with the passage of the 2020 George Floyd Justice and Policing Act, this probably will be part of police training, introduction, at least in the basic training academy and the in-service training, this notion of slowing it down, this notion of de-escalating whenever possible. So I thank you for that, Chief Kott. Anybody else want to jump into that, or do you want me to move on?
I would just say active listening skills. I feel like, before we assess others, sometimes we need to assess ourselves and really, focus on the role we're playing at that current moment and how we're impacting the situation. And I think if we put the focus on ourselves for a little bit, I think that would help de-escalate instead of escalate, because sometimes it could be us that are the ones escalating the situation. And if we don't assess ourselves, it would be difficult for us to really manage the situation.
And if I may, just to piggyback off the last 2 speakers, the Chief and Ortiz, I think what you can do on things like that is to ensure that you don't zoom out. You don't allow yourself to focus inward to the extent that you forget about your environment. You have to be aware of the environment. And I think Officer Chauvin did not take into consideration the fact that he had 4 other officers on scene. and that who have handled the situation, that have provided the necessary protection. So it made it difficult because they did not focus on what they could have done outside of just using force. It made it very difficult for them to see their options. It's almost like it created a sense of us versus them. They felt they were threatened, and when the threat was not that strong. So they extended that perception to George Floyd. So that's like he ended up staying on him for 9 minutes as opposed to just sit him up. And he pretty much forgot his entire training and decided to do exactly what Instant taught him. And that's because he kind of forgot to look beyond his law enforcement microscope and see that, you know what, I have options here, and may trust my officers on scene and be able to do the right thing.
And just to kind of reiterate what everybody's saying, you know, I worked in a crisis unit before, and anytime a child was in crisis, you know, I can't go into that crisis with a crisis. I have to check myself, like Chief Kott said, you know, taking that second and asking myself, what are my biases? What am I doing going into this situation? How am I going to check myself before I respond? Because you can't respond to a crisis with a crisis. It's never a good outcome.
Yeah, and I just wanted to add on to what the other panelists are saying. This ties into all of it. Also having empathy, just like that word, right? George Floyd was obviously very distraught when they pulled him over. And I think he even mentioned in the video that this had happened to him before. So he has a history that probably makes him uncomfortable, makes him scared, anxious. So having some empathy for that other human being on the other side then really allows you to then slow down and take the steps that Chief Kott, Alfred, and Justin have been talking about, and really, you know, take that moment to think, slow down, and assess the situation appropriately. But first, you need some of that empathy for that other person.
Can I say something? This might not be the right time. I'm Julie Thomasis, and I'm a board member of the Lehigh Valley Justice Institute. And I'll just say this briefly. One of the things we're working on is an alternative on 911 emergency response. And I'm sure, Chief Kott, you've heard about this, and some of us have met with you and talked to you about this, but we're working really hard to implement some kind of alternative response model, whether it's co-responder or cahoots, to deal with mental health, substance abuse, homelessness, calls for service, so that we have a behavioral professional that responds to these. And even in a co-responder model, at least it's a police officer with a co-responder, because it's just too dangerous to have someone who's having a mental health breakdown, who's nonviolent, non-criminal, unarmed, often deal with an armed police officer. So that's one of the things that I think that we can do. And I'm sorry to take so much time, but that's something we're working on.
Thank you.
If I can jump in really quick too, Bertel, I know you wanted to talk about the different legislation that's out there currently. I know in Harrisburg, Senator Casey, I believe, was trying to pass legislation about some type of almost like a 311 system, where individuals can call rather than calling law enforcement if they have a loved one that is in need of programming or services. So that's more legislation that's out there that showing like the different avenues that I think society is looking for reform.
Thank you.
If I may, Julie, what I'm trying to understand, I think we have similar program like that on our department. It's called SAM 800, where we have co-responders. As a matter of fact, in some instances, SAM 800 responds on their own, and if they feel there is a threat, they call police as a form of backup, but police is just in the background for public safety. SAM 800 does a lot of talking and all that. But what I'm trying to understand, is it going to be, are you guys trying to do it on the statewide level, or is just going to be on county or municipality levels?
Well, right now, we're hoping to start a pilot program. That's how many of these are started. And because the issue, I think the logjam is at the dispatch level. And that's in Allentown, whereas Allentown used to have their dispatch in the city, it's now at the county. So the county and the city have to work together to make that happen. And I think the concern is that the mental health worker or social worker is at the scene, not just a caseworker that's connecting the person with resources afterwards, which is really important. And of course we need that so we don't have repeat calls if possible, but someone who is really on the scene. But again, right now, I'm hoping some of this rescue money can be used that goes to the city and goes to the county to make this happen. But because the dispatch happens at the county, we're working with the county, and hopefully we can use Allentown as a pilot. And if not, we're going to use, hopefully we can use Bethlehem as a pilot.
Okay, thank you very much for that insight. Anybody else want to add to that line of discourse, or are we okay to move on? Okay, I'm just throwing this out to the panelists. What philosophy have you practiced throughout your career to help break the stigmas surrounding mental health, addiction, and deviant, delinquent, or criminal behavior?
Empathy, treat others the way that you want to be treated. I think that's so incredibly important. And there's no one out there that has experienced everything, but there is so much strength in the ability to recognize and appreciate another person's perspective. And that's so incredibly important. So kind of as Berto said about having that empathy, understanding that though I may not have ever experienced something somebody else has, their opinion, their perspective is valid. And conducting business, whatever your occupation is, with that in mind, to me is the right thing to do.
And just to piggyback off the chief, what she said, when I was in patrol, one thing I learned is that people, no matter how bad it is, people will respond. I give you an example. I pulled a lady over, she was pregnant. When I pulled her over, I can tell you, God above man, because she flipped out on me. She went all off on me, yelling and all that, talking. I recognized right there and there that it was not about me. It was not about me. There was something going on beyond the traffic stop. She ran a red light, it was obvious. And after 5 minutes of venting, obviously I had to take into consideration my safety and all that. After 5 minutes of venting, I kept calm, kept talking to her. She calmed down and said, "Officer, it's not about you. I'm sorry. I just have too much going on. I'm pregnant." And she went on and explained things. And what I realized is people have days. People have moments. And in as much as we have a responsibility to go home to our families, we also have a responsibility to exercise a level of awareness that is very critical to our own safety and our own protection too as a person. So you just approach everybody with an open mind, with an understanding that they too deserve to be heard, they too deserve to be understood. Even if you are going to give them a ticket, if you are going to take them to jail, you have to be able to explain yourself to them so that the situation can be calm. Because if you don't explain yourself to people, they will not know exactly what you're doing, and that's how problems start. That's how you end up in IA, that's how you end up having issues and use of force and all that.
Yes, and especially that's difficult in a multicultural society where we tend to exercise the golden rule, treat others as you would want to be treated, but in a multicultural society that might not work. And we might have to exercise the platinum rule, treat others as they would want to be treated. And so certainly some multicultural competency is involved in how we go about the business of dealing with the citizens, I suspect.
So I was going to say competency trainings, definitely want to enhance your knowledge, become more informed about mental health and addiction and crime. I feel like exposure through increased contact can help gain better perspectives and, obviously create like less stigma, and you become less stigmatizing. So definitely want to know your community and the people you serve, and the factors of, mental health and addiction and crime, like environments, trauma, and different dynamics that go on in households and communities. And I think when you get that type of knowledge and enhanced awareness, it's easier to have a better understanding of the people who face those difficulties, and it's easier to serve them once you have that understanding.
Yeah, and I just want to kind of piggyback off what Justin is saying. It's also really it's critical to use the knowledge that the community you have is serving. Use their knowledge, make that the foundation and the core of what you're doing. Because as people who are directly experiencing these problems and these issues, they have expertise, right? And so when we use that knowledge to base our solutions and our initiatives on, then we're that much more effective. It's just really critical to do that. I think one of the biggest pitfalls in social work, in whenever you're serving anyone, right? Like not just anytime you are working on behalf of another person, is thinking about what you think is the right thing based on what you know rather than what they know. So when we make that switch, I think we'll find that we're much more effective across the board in any space.
Yeah, like Ms. Kott said before, you want to treat others how you want to be treated, and there's no better way to do that than to put yourself in someone's shoes. And I think that's really the whole dynamic of it all, is like, through training and competency, you get a better understanding of what these shoes look like and how they are. And when you could put yourself in those shoes, it's easier to become, more aware and less, have less stigma, because you have the knowledge of what these people are going through.
Thank you for that insight. Dr. Hanif Bey, I have a question for you. How can social workers impact justice reform as we work towards breaking the stigmas of mental health, addiction, and crime?
Sure. Thank you, Vertel. So in terms of justice reform, it's gathered quite a bit of attention recently, as it should. But it's not a new concern for social workers in terms of our values for promoting social justice and working with and on behalf of vulnerable, stigmatized populations. Whether we look back to 1899 in Chicago and the establishment of the first juvenile justice court established by Jane Addams, Julia Lathrop, or even currently now by U.S. Congresswomen Bass, Representative Bass, Representative Val Demings, and Barbara Lee, and the influence that they've had, all three of them social workers, pushing the George Floyd Justice and Policing Act. So social workers have been involved at the forefront. And in terms of my own direct experiences, back in 1990, as a forensic social worker, I worked with the Legal Aid Society Criminal Defense Division. And what we did was we worked collaboratively with attorneys, with investigators who were oftentimes private, retired police officers, in order to work with non-violent offenders, getting them out of prison and into programs, whether it be substance abuse programs, whether it be mental health programs, really looking at the individual as a human, as opposed to seeing them as some sort of criminalized body. And we acknowledge that many times, unfortunately, these criminalized bodies are people of color. And so this program that was initiated back in the 1990s really worked to get these individuals out of prisons, into the community, into services, and it helped break the stigma of mental health, criminalization, and substance abuse as well, and really reduce recidivism rates as well. And then for the last 16 years as a social worker in the hospital, one of the things that we work on in terms of language, the language that we use towards other individuals is crucial, because in a hospital, the model is a medical model. And the medical model looks at individuals and pathologizes them and look at them as their diagnosis as opposed to their individuals. So you have people that use language like the drug user or the crackhead or something like that, as opposed to saying an individual or a human being who happens to be addicted to drugs. So the language that we use as social workers and other individuals who have conscience could share that information and help break the stigma, not just from a micro perspective, but also from a macro perspective as well. So I think these things that we can do, the small things, like the language that we use, how we treat another individual based on their strengths, because if we look at it from the perspective of their lives, right? If they show up in our offices for help, that's a sign of strength, right? Even though they may be addicted to drugs, them showing up demonstrates that they want to change their lives. So we have to grab on to the strengths they have because they really are the experts of their lives. And so that's how we can break the negative stigma that's attached to crime, mental health, and addiction.
Thank you for that. Mr. Brian Sabo, let me just, I'm directing this one to you. I've been keeping track of the Portugal experiment where in 2001, they decriminalized all drugs and, use decriminalized, not sale, transportation, distribution, et cetera. And so the prediction was Armageddon, Portugal would collapse, crime would be out of control. And in fact, none of that has happened. And they took away the problem of addiction and drug use and abuse out of the realm of the criminal justice system and put it into the realm of the public health system. What are your thoughts on that? And I know that's a curveball, it wasn't on the list, but I'm sure you have something to say about that. But can you share or give us some examples of work being done in your organization that attempts to break those stigmas? And are any programming designs or frameworks looking at countries like Portugal and in an attempt to improve, how we treat people who are addicted to controlled substances?
Sure, I can speak on, breaking the stigma, being a person in long-term recovery. There was a point where I had no choice. I didn't have an option whether to or not to use drug and alcohol. And at the end of the day, those of us in recovery and in addiction, we're good people who suffer from a disease. So you have a coworker of mine on the call, Maggie. She runs 2 of the recovery centers myself, but we do a lot of outreach. One of my first calls when I opened up the Hope Center here in Bethlehem was at Chief Kott, and her deputy chief came down, and they were so receptive of what we're trying to do, and we're working with them now currently with the PAIR program, the Police Assisting in Recovery. And just in a nutshell, the police officers, if somebody's willing to get treatment, they can drop them off here at one of the centers at Northampton County Funds, and we can get them into treatment the same day. Because we are good people. And, part of my recovery and everybody in recovery is like giving back to the community. And, we had started a community garden in the borough of Northampton, for example. And we had gotten together with a community group called the People Standing Up Group. We were able to obtain a grant, and we made this huge, beautiful garden with 25 beds. And last year, this is all during COVID, right? This is the special part. And we were able to harvest 900 pounds of fresh vegetables that were directly given to the Northampton Food Bank, giving back to the community, making community relations, that, people hear addiction and people in recovery, they think of like people living underneath the bridge, and it's not like that all the time. And even if they were, it's okay. They want to come into one of these centers, Maggie centers, my centers, they want a big hug, we give them a hug. We love them up, get them into treatment, get them help, and they give back to the community. So, and in regards to, what you said about those studies, I don't have anything to say about that. My apologies. I just know that, addiction and recovery is a real thing, and recovery works, and like the other panelists had mentioned about, looking and especially the wordage, you know, we are individuals, we are people who are overachievers, who are hardworking people, you know, and we would love to give back. Thank you.
Thank you for that insight.
May I add something? This is Maggie here from the Palmer Recovery Center.
Okay, hi.
Hi. Brian, thanks for everything you said. You know, he and I have the same mission, and that's to, you know, help people overcome the disease of addiction and go on to help other people. And that's what was done for both of us. I have kind of a personal anecdote that kind of touches on what you originally asked. So my first encounter when I was active using drugs and alcohol, the first chance I got for help was because of the Bethlehem police. I had a welfare check done on me, and the police could have taken me one of two places, the hospital or jail. And they took me to the hospital. Excuse me. And I know that that is not the case for everybody. And I can recognize some of my privileges as to why I was taken to the hospital and maybe not to jail. And so, you know, because I've experienced it firsthand, the difference between my disease being criminalized and being seen as a disease. And I've seen clients of mine who their disease was criminalized and it just kept them stuck in the cycle of addiction longer, right? So, you know, what could have happened to me, which I've seen happen to other people, is, you know, I could have been arrested. Because of that, I could have lost my housing. Because of losing my housing, I could have ended up on the streets. And on the streets, I would have probably continued to use. Now, if I was using on the streets, I probably would have gotten citations like public intoxication, you know, et cetera. And, you know, stuff like that is what can keep people from being housed or receiving a voucher for a homeless shelter. So, you know, I've seen the cycle work. I had the best case scenario happen for me. I was extremely fortunate to have the best case scenario happen for me, and that the police chose to take me to the hospital. I was not super compliant with the police. I was not very polite with the police. And I'm very fortunate that my story turned out the way it did, because I've now been able to go on to help other people and to use my story to help other people. And I think that is where we need to focus on is, you know, people often, their first encounter is with the police if they're in active addiction. So I think that that's just such a great opportunity to save lives right there, right? Whoever that first point of contact is, it might be the hospital, it might be the police, it might be one of our community centers, which is, you know, great. That's what we want. Just like Brian said, for somebody to be dropped off at our center and be able to get help right here, because we can understand in a way that no one else can, right? So us being able to work with the police or work with somebody like the social worker that's going to accompany the police on calls, that's best case scenario. And, you know, that first encounter is what we really want to focus on, and making sure that that's as productive and safe and effective as possible. Thank you.
Thank you for that, Ms. Maggie Palmer. I'm going to jump to Berto Sicard on this question, because a lot of addiction-related problems fuel mass incarceration. And I would like to ask, what are the challenges that you encounter surrounding mass incarceration, and how can we work to address them? And then how can we dismantle it and work toward you know, decarceration, especially with nonviolent offenders or those who have addiction-related problems? And if you can throw in on that, how the First Step Act, which is being touted as one of the greatest acts ever passed in 2018, has that really impacted mass incarceration?
Thank you. I'm gonna focus on the federal on the First Step Act. So just some background on the act. It has several provisions in it The one that's been kind of the most touted is the one that aims to address minimum mandatory sentences, as well as sentencing for what they call serious drug offenders. So reworking some of that verbiage and understanding to bring the sentencing down for people who have who have committed drug offenses. That's what the act does. It's really in response to some of the things we've been talking about, but that Hanif, I think, brought up earlier, some of the laws passed at the end of the 20th, at the end of the 1900s, which worked to really crack down on drugs. And those laws were bipartisan supported, right? So we saw Republicans support them, we saw Democrats support them, and they were an attempt to clean up inner cities, right? To make them safer. We've even James Foreman, who's a professor at the law school at Yale, wrote a book called based on how even the Black community supported these laws, because they were their neighborhoods were seeing a lot of not just drug-related crimes, but also violent crimes. And so there are ways in which even some of our community supported these laws, but also fought against them, right? Both things were happening, but those laws work to create what we call mass incarceration. So starting with those laws, the prison population in the US has risen such that we now have the largest number of incarcerated people in the world, despite not having the largest population in the world. We have the highest rate of incarceration, and those people are disproportionately people of color. And so the First Step Act aims to address some of that with getting rid of the minimum mandatory sentences. So that's some of that is what you would call like the three-strike rule. Once you have a certain number of felonies, you are required to be given a life sentence. And this isn't the Trump administration passed that law. I also want to go back a little bit. 8 years before that, Obama passed the Fair Sentencing Act. So this is, again, just like I mentioned earlier, mass incarceration was a result of bipartisan policies. Dismantling it will need to be a result of bipartisan policy. And so Obama's law aimed to address the sentencing disparity in crack versus powder cocaine. And so that I really do see it as a continuation of some of that. I also do see it as a low-hanging fruit. And so when Dr. Martin discussed, how much has it really done? It obviously has positively impacted incarcerated people who were given very stringent and high sentences for drug-related offenses. Now, if we really want to dismantle mass incarceration, which was another part of Dr. Martin's question, how do we do that? We have to go beyond these laws. So the reason why they were able to get passed and get bipartisan support in Congress is because they're low-hanging fruit. We can all agree that minimum mandatory sentencing really does harm people, right? It keeps them in jail for too long. Now, when it comes to what policing looks like, when it comes to what Dr. Martin got to a little bit in with our neighbors to the south of our nation, decriminalizing drugs as a whole, those are much thornier issues that are hard to rally support around. But those are the solutions we should be working toward to really dismantle mass incarceration. And so I think the First Step Act is what it says it is, right? It's the first step. We have a long way to go to really reimagining criminal justice. And part of that includes what we've been talking about, more accountability in policing, more empathetic policing, better support systems for people who are suffering from a drug addiction and who are being released from incarceration, better sentencing practices at the local and state level as well as the federal level. So these are all things that are harder to rally support around politically, but are really the policies that are going to help us change the way that we look at crime and incarcerate people.
Thank you. Anybody want to add to that topic? or the topic of mass incarceration? If not, I'll move on. Reform in action is my next area of study here in the questioning. And I'm gonna direct this to Chief Kott first. And then I'd like Ms. Jordan Westerman to jump in. So my question to Chief Kott is, can you describe the new pilot program that you recently implemented involving a partnership between the Bethlehem Police Department and the Bethlehem Health Bureau, which is innovative, to say the least. And also, after that, Ms. Westerman, can you give us some examples of what types of situations a social worker handles while embedded within the police department? In other words, what's your role? What outcomes do you see as you are doing your practice to assist police with social services?
So something that I tell people is I'm here to get it right, not be right. Brene Brown, podcaster I listen to, that's like one of her main sayings, and it really, really makes sense. Kind of what Berto was talking about, it's counterproductive to have law enforcement come into a community in which they serve and tell them, these are your priorities, this is what we're going to do. You have to hear what the community members are saying. That's in essence what policing in a democratic society is. So when I was put in this position, listening to what community members were saying, what was going on a national level, we're just going through this cycle. And similar to what Maggie said, where police are responding for calls for service, there are times where they're being provided with services and programming that can help give them a step up out of something they're experiencing. But there's also those circumstances where they are arrested, they are fined because of circumstances in their life and the disease that they're encountering, they're not able to pay that fine. And then a warrant's put out for them, and it just keeps going and going and going. Watching on a national level, various use of force incidents that were occurring across the country, a lot of the individuals that were involved had repeated contact with law enforcement, and we're stuck in that cycle. So we reached out we are very blessed and lucky to have a health department here in the city of Bethlehem. There are a lot of places across the state, the country, that don't have that. So we were able to reach out to those subject matter experts after listening to the community's call for better services from law enforcement, and kind of ask them, what do you think we can do here? How can we work together to more efficiently and effectively address underlying issues in the community? A lot of people on here, they may not remember President Reagan, but during his administration, they defunded a lot of the mental health resources out there.
Put everybody back on the street.
In the country. And what do you do with all these individuals now? That where there was programming, there were places they can turn. Now the people that they're dealing with is law enforcement. So we really needed to think of a way to better address those underlying issues, but also I see it as a way to reduce calls for service. If you have an individual that you're being called to their house for domestics, and the underlying issue is we're in a pandemic, people have lost their jobs, which could result in food insecurity for a family, which could result in two spouses arguing more often and police showing up. What can we do to cut down on those reduced calls for service? So after the 20th or 50th time we're there for a year, if there's a use of force incident, that doesn't occur. We're able to try to help those individuals get access to programming or resources through the city or through the county. And that's where Jordan comes in, and that's what this partnership is about. is cutting down on those reduced calls for service and helping people so they don't need to call law enforcement. So they'll be able to go to those subject matter experts that can help them. Jordan, do you want to jump in?
Yeah, so I'll just start by saying kind of what my role is, and then, just some of the things that we've been experiencing and some of the outcomes. So what happens is police go out on a call. Anything social service related then gets referred to me through an email. And the referral can be anything from depression, medication noncompliance, suicidal ideation, undiagnosed crisis, addiction, domestic violence, elder care, home care gap, food insecurities, veteran services. I mean, the list goes on and on. Anything that's social service related is going to get forwarded to myself. And here was the gap that we kind of see happening is before social worker intervened with police. The police would go out, they would make a referral to the county, but if that person didn't need county services, they didn't get services because the county only takes people who are in an absolute immediate crisis, in danger to themselves, to others, or completely inhabitable conditions. But those people that are in the in-between get missed. So like Chief Kott said, we'd have somebody who, wasn't taking their kids to school, for an example, and the truancy is the issue, so the officer goes out because the kid is not going to school. But then, they make that referral, but it gets missed that, they're losing their house. They can't pay for their rent. They can't pay for groceries. Their kids haven't eaten in a week. That now gets missed because they were only out there to make a referral for this reason. So what we do is we do a full assessment. We do depression screenings. We do, a full health assessment. We look at the biopsychosocial well-being of a person, a holistic approach. So if somebody gets called for domestic violence, we're not just sending them to Turning Point. We're also getting them enrolled in other things that are going on in their life, because we can't just fix one problem if everything else is falling apart in their life. So, one of the things that Chief Kott and I always talk about is that there's no reason somebody should have 13 encounters with police before an intervention happens. After the 13th encounter, now a very serious intervention is happening, when at the first time that they were intervened with police, something could have changed. So that is what we are trying to do. We want to get people the help that they need, the actual help that they need. So I can tell you that from our data that we're collecting, it's very successful and it is working. Since November, 42 people were referred to us from one platoon. We're just piloting one platoon right now. Out of those 42 people, 30 people were connected to services, and after 30 days are still in services. That's a very high rate, for a pilot program. We were expecting 20%. We're way over that. 8 people we were unable to reach, and only 4 people declined services. When people want help, they want it. Only 4 people declining services since November is an amazing outcome. So I am really excited about what is happening here, because as Chief Kott calls it, the marriage between police and social work is such a beautiful thing to see, because it really does make an impact on the community. And we have gotten so many people from the community that are like, every time we call the families, they're like, this is amazing. I can't believe this is actually happening. And just hearing that somebody cares, when we call and say, I know police were out there, just to hear their story, just for them to explain, this is what happened. This is why we're going through this. And to be able to actually give them something that, is going to create change for not just the individual, but the whole family it's been a really awesome experience, and the outcomes are proving that it's working.
It also, if I could jump in real quick, Vertel, it's also changing the culture and the norms inside the police department. So before, when an officer encountered a community member that, their information needs to get referred down to the county for Department of Aging, for any type of social services, officer didn't hear anything else about it. So they're not sure, is that person receiving services? Are they getting better? What's going on now with Jordan? That communication is streamlined, and Jordan can reach out to the county to check in and see how people are doing. Are they following up with resources, programming, treatment? Also, the success stories have been huge with officers. I think in law enforcement across the board, there is this tendency only to recognize things that are considered valor worthy, running into burning buildings, being involved in apprehending major offenders. All too often we forget about the things such as these referrals that help someone get clean and be on the pathway to recovery. So that's something that we're really trying to recognize as well, where when Jordan sends me an email telling me that a community member thanked the officers for the referrals, couldn't believe that the police were involved in a program like this, I go to roll call and I read that out for the officer in front of their peers, because we want to recognize that, because to me, it's just as, if not more important than somebody that makes a major arrest. So we're addressing the culture and norm in law enforcement as well.
And I always, Chief Kott knows, I always give this analogy, if I am having a medical problem, I'm going to go to the emergency room to stabilize my medical problem. But then if I continue to have the medical problem and it's non-emergency, I'm going to go to my primary care doctor. And that's kind of how I look at this relationship between police and social workers. They're there to respond to the emergency, but the missing gap is the person that can continue to keep up with these people. When I get a referral, I've already had the established relationship, from the beginning that, hey, you were back with police, what happened? And I think that analogy just explains it so much. That was the missing piece. And I really think that we're capturing that now and we're able to intervene correctly. And I'm very excited about what we're doing.
And I thank you for putting those statistics out, because that was going to be my next curveball question. How are you measuring efficacy, effectiveness? So I appreciate that you had those stats, and you're letting us know that even though it's a pilot, you're keeping track of it to see not only you're not only measuring efficiency, but you're also measuring effectiveness. Also, it sounds like we're moving away, hopefully, from social sanitation techniques to real root cause, problem analysis and problem solving. So I appreciate certainly Dr. Kott undertaking that programming, and I'd be very interested to see how the assessment comes out eventually. Now I want to jump to Mr. Brian Sabo again, because I don't want to overlook this important point. The opioid crisis existed before the pandemic, and it's still in existence post-pandemic. In fact, overdoses are sky high.
Yep.
My question to you is, how are you obtaining assistance for addressing this problem? How is the local government acting or reacting in terms of resources, equipment, personnel, funding to help your center?
Sure. So Northampton County is very proactive. For example, they just started a HERO program. It assists those who have opioid use disorders. For example, they get initial assessment, and this is all free. They get assessed into treatment, and they will help support their living conditions for up to 6 months. They've increased CRSs and case managers in all 5 of the recovery centers that we have here in Northampton County. I mentioned the PAIR program with the Bethlehem Police. I know Maggie is working with the other police departments in the area. We have a host program, the emergency rooms in the hospitals, where if someone has an overdose or is deemed necessary, they can get assessed inside the hospital and in treatment. They were also working closely with the Bethlehem Health Bureau to ensure distribution of Narcan throughout the community. And, I think the big thing is, for these recovery centers that they fund, they assured funding for, they're actually prioritizing funding for future recovery centers in the years to come, because we need a safe haven to come to. And this is what ultimately these recovery centers are, a safe haven where we can feel safe, be ourselves, and work through our journey of recovery.
Thank you for that, sir. The next one, I'm going to be a little like a proud mother, I guess you would say. And I'm going to direct this to Mr. Alfred Johnson and Mr. Justin Ortiz, because they're alumni from NCC. And we have a lot of students as participants. So here's my question to Mr. Johnson, I'm sorry, Detective Corporal Johnson and Mr. Ortiz. What advice would you give to our current students as former criminal justice system students yourselves, and now you are a criminal justice or related practitioner in the field?
Well, let me see if I can go first. As the discussion is very clear, the field of criminal justice intersects seamlessly with other areas. So, as a student of criminal justice, you have to be resolved in your desire for the profession because it requires a lot, not just your academic strength, it requires your professionalism, it requires your ability to think outside the box, and it requires some level of flexibility. So you have to be resolved, but you also have to be flexible. And what do I mean? Even though the sector has different components of law enforcement, prosecution, courts, and corrections, the relatable nature, the relationship between these various components of the system makes it very important that every subject matter you approach, you have to approach with some level of seriousness because you will encounter them in the future. I give you an example. When I was doing my undergraduate program, I interned with the Luzerne County District Attorney's Office. And while I did not pay much attention to juvenile justice classes, I was dealing with a youth aid partner program. It was a diversion program where troubled juveniles are diverted to the program as opposed to putting them in juvenile justice. So you have the juvenile justice and criminal justice. So the youth aid panel was below the juvenile justice system. So instead of taking them to juvenile justice, we just deal with the youth aid panel as a diversion program. So that helped me. I mean, that was very important. And if I had paid more attention to juvenile justice classes, I would have been more informed, but it was very critical for me. So you have to look at it from a different perspective. And from all the panelists here, mental health and all these things, you have to be able to incorporate all these lessons and take them in ways that at least apply the level of seriousness and the level of equal approach to it that you would do with what you think would be your area of expert or interest in the field of criminal justice. So just be resolute, but be flexible and be committed to the process.
Absolutely. And my advice would just be to know your strengths. Social work and criminal justice, they overlap. All the classes that I've taken in NCC and social work, they overlap. And, when you know your strengths, it's easier to kind of implement them and put them into practice. And, me knowing my strengths, I knew the direction I wanted to go and the impact I can provide. And, that's really it. Just try to focus and assess your strengths and take the knowledge that you attain to really make the best of what you're good at.
I couldn't have put it better myself if I wrote the script for you. Thank you. Okay, the next question is to Dr. Hanif. Since we did speak a lot about the juvenile experience, right? So at ESU, you teach crisis intervention, child welfare services. How does the intersection of mental health, addiction, and delinquency and crime influence the childhood experiences and trauma?
Sure, thank you, Vertel. So research shows that over 70% of child maltreatment is related to a caregiver who has some sort of substance abuse or mental health challenge. And we have to acknowledge the fact that many of the individuals that come into contact with the criminal justice system have experienced some form of trauma as a child in their life, whether it be child abuse, child neglect, or some sort of household challenge that kind of set this negative trajectory on its course, right? And so, Kaiser Permanente, they did a study called the Adverse Childhood Experience, or ACE, right? And so these ACE scores determine whether or not an individual who's had a significant amount of childhood abuse or neglect or household challenges also had a relationship with some sort of health condition, medical health condition. So in other words, the higher the score, the higher the negative trajectory that was occurring to many individuals. And people who have high ACE scores not only have medical health issues, but they have mental health issues and substance abuse issues. So without some sort of intervention, and I know Ms. Westerman talked about the impact that intervention has, what we find is that individuals who have mental health concerns, substance abuse concerns as well, there's a gap in the services because individuals either have no insurance or they have underinsurance, whether it's Medicaid. And as we know, if you have underinsurance, it's difficult to find a doctor, whether it's a primary care doctor or even a mental health doctor as well. The waiting lists for these individuals are very long. So when it comes to this work with individuals who have contact with the criminal justice system, we have to acknowledge that they have had some form of trauma in their lives. So as social workers, taking on this trauma-informed approach is crucial. What this means is, as opposed to saying, what is wrong with you, is saying, what happened to you? What happened to you, right? Because when we take that approach, we humanize the individual, because when we look at the word reform, reform means to change, to make better. And what this means is that what we're doing now is not working, right? These approaches that we've been using in the past is not working. It's not cost productive. It costs much more money to put an individual incarcerated than it is to provide substance abuse services and mental health services as well. So as social workers, we can make a difference in our approach. We could be empathetic, our empathetic skills, our working skills, using active listening, right? Listening to individuals as speaking over them, right? Acknowledging them as human beings, taking an anti-oppressive, anti-racist approach, looking at individuals for who they are as human beings who've experienced a trauma, and our job is to listen and see how we can help, not do things for them, because as it was said earlier, people want help. They just need an opportunity to do so.
Mr. Bay, I commend you on that. That's the ACE study was something I definitely wanted to speak about today, and you hit it right on the nail. So I really commend you on that.
Powerful. Okay, I think we are at the time where we need to open this up for the Q&As if we have any. Katrina, I'm not good at multitasking on Zoom. Do you see any questions in the chat that?
Yeah, we have two. So
okay.
If we start, the first one is, where do you see, and more importantly, where would you like to see the court system in the framework we've been talking about? Maybe Chief Kott would be the best person to answer that.
Sure. So I think because, and I think Alfred mentioned how the criminal justice system is much bigger than just law enforcement. You have corrections and the court system. If we're going to change and reform the criminal justice system, it has to be across the board. It cannot just be law enforcement. It can't just be through legislation. It has to be all three parties. So where I see it going is everyone needs to come to the table and be willing to change. Reform is not a dirty word. It is not a scary word. You have to embrace it, and you have to work together to try to find out what's going to be best for our communities.
And let me just follow up with what the chief said. And what we notice is some of the new forms of the court process, like the not juvenile code now, but the mental health code, domestic violence codes, all the different aspects of the court system are relatively new. So the criminal justice aspect of the court system has been there, and I don't think it would be fair for us to go on the extreme end of the spectrum to say, let's move much more to social. We have to have a balanced approach. But the new reform should accelerate and push, we accelerate the entire delivery of the mental health code, the domestic violence code, and all these things, so that it can come on par with the criminal justice system as it relates to the prosecution of crimes. Because at this point, it's almost like domestic violence code is there, but almost everything is becoming so criminalized that even domestic violence code, mental health code is almost like a rules to engage, to push the people back into the criminal justice system. It shouldn't be like that. The system, those various courts you have to have the resources to come on par with the actual criminal aspect of the court system.
Yeah.
Yes, and the specialty courts that you mentioned, certainly, Detective, they should rename themselves to the problem-solving courts, because if you just keep it in that one category, yes, we tend to err towards criminalization. Yes,
Yep.
I'm sorry, I interrupted somebody.
Yeah, I just wanted to add, just reiterate that the courts, are a really critical part of this. We need to be able to equip the judges to make these decisions as well. Like, when it comes to sentencing, for example, I talked earlier about the First Step Act. There are mandatory minimum sentences. So giving judges not just better guidelines and more fair and just guidelines, but also releasing tools to help them better understand, like, what not just because if you open the door to them to sentence people however they want, we might still have similar issues, right? So we need to make sure that we're not just getting rid of these sentencing minimums, but also introducing guidelines that they can use to sentence people in a fair and just way, especially if the crimes are drug-related primarily. I know that Lehigh County and Northampton County are ushering in drug courts. So that's another specialty court that's a really critical step to this. At the federal level, the president appoints judges. We need to make sure that we're advocating for the types of judges that understand and have this sort of empathy in mind. As we talked about, like, empathetic and humanistic policing, we need to make sure that the judging is done in a similar way. And then at the state level, Pennsylvania, one of my gripes with Pennsylvania actually is that it elects judges, which seems to go against everything that the federal judiciary stands for. But at the state level, ensuring that we're electing judges as well that understand the benefits of what we've been talking about and are willing to advocate for these strategies and solutions at the local level and the state level is really important. So educating the community about judges who are running for election, and ensuring that we are making conscious voting decisions when we're thinking about who should be running our court system.
And if I may,
yes.
and if I may, real fast, just to kind of piggyback off of what Wilberto just mentioned, Northampton County here, drug court is now called recovery court, because that's what we do is recovery, and that's a big step. And I see it every day. We have clients that come in the center and they are improving themselves. Like, for example, this weekend, we have an art show with one of the clients, and her work is beautiful. And she was so unsure of herself for a very long time. This is just bringing out her inner self. Thanks.
Do we have anything else, Katrina, in the question box?
A couple questions still. So we do have one for Chief Kott and Detective Johnson. Just kind of asking, how much interdepartmental collaboration occurs when it comes to the criminal justice reform. Obviously, Chief Kott, you have some examples with Jordan, but are you guys able to bounce ideas off of each other? And then kind of a second part question for Chief Kott and Jordan, are you seeing changes in attitudes of police officers with the partnership that you've established with the Bethlehem Health Bureau?
I'll let the chief go first.
Oh, okay. Thank you, sir. So, right off the bat, it depends on the other agency. So we're all in the same building, and we've had really good relationships with the health department prior to the collaboration. But when you're in the criminal justice system, it's like any other profession or entity, you're going to have departments that are led by progressive chiefs that are really interested in collaborating and bouncing ideas back and forth. For example, Chief Granitz in Allentown has been a phenomenal partner since I became chief, with being able to kind of reach out to him and bounce ideas off of. There may be some other chiefs out there that aren't as receptive to change. So I guess it's situational. It really depends on the other entity and how willing they are to be a partner in moving forward. Alfred, do you want to tackle the question, and then we'll move on to?
Yeah, I think the chief said it right. It depends on the agency, and for us, one of the things we have is the 700 we have here. The working relationship is strong because 700. I don't remember the time I talked to a supervisor of 700. I've always interacted with the field officers, the individuals that go out to these mental health calls and all that. I've always interacted with them, and we bounce off ideas each other. I remember when I was in patrol, District 7. We went on a call for service, and this girl was trying to kill herself. So with the department, we have different standards. We have questions. Do you want to? Are you a threat to yourself? Are you a threat to anybody? She said no. So we could not take her in for EPS, emergency petition services. When 700 came, they were more versed in the kind of questions that needed to be asked. So they asked much deeper questions to be able to assess us beyond the basic question we asked. After they did that, they themselves were able to say, no, we need to EPS, and we didn't take offense to that. What I did was I called them back, and we had a conversation, said, yeah, this is what we do, this is what we don't do, these are the questions we ask that you guys don't ask. So that relationship gave me a different perspective. So anytime if I have to go on a mental health call, I would ask the 700 person, I would defer to the 700 person as opposed to using my basic police question, because if I ask the basic questions, I may not get what needs to be gotten, and I may have to go the criminal route, as opposed to a mental health person asking the question and knowing, this person needs to be deferred to mental health code. Even if they go to jail now, they have to be deferred to mental health code as opposed to putting in criminal code. So again, it depends on the organization and the department and the level of receptiveness that the chiefs are. Some chiefs are progressive, some are just stuck in the old ways, and it depends who you get. If you get the one who is progressive, you will embrace the mental health approach towards law enforcement and make sure that all the officers themselves go along with it. If you have somebody who is stuck in the old ways, they will say personal responsibility, or make the claim of personal responsibility, and boom, take the person to the criminal justice system.
And just to address the other question that was asked about the attitude of police officers with the partnership, I think that we really have a good response from police officers because their chief believes in it. You know, it comes down from the people that you're led by. If they believe in it, they're gonna, you know, you as a worker are gonna believe in it too. So I think it starts with that. But one of their questions is, did we do something wrong? Are we doing something wrong? And I think one of the best things we can do as social workers is prevention. Even though something wrong hasn't happened yet, let's not wait until it gets there. So I think their attitude we work great. I work great with the police officers. There's no, you're a social worker and I'm a police officer. There's not that kind of attitude. I feel we both respect each other's professions and understand the need for both intervention. So.
And unfortunately, I think you'll agree, Katrina, we've reached our point where we need to depart. And I just want to sincerely thank all of the members of the panel for not only the delivery of your expertise, but the passionate delivery of your expertise. I'm taking something away from today, and I'm sure many of the participants in this panel are taking something away too. Katrina, do you want to take over your role as host?
Yes. So I know we didn't get to all the questions, so I can also shoot them out to the panelists, get some responses, and when we send out the recording, we can tackle those. But thank you guys all so much for being here. Great panelists, great discussion. Thank you. We are recording, so anyone that registered will get a copy of it, and we'll make sure to get out to our panelists. But just wonderful job, everybody. Thank you so much.
Thank you so much, everyone.
Yeah, thank you.
Thank you.
Thank you all.
Thank you, everyone.
Thank you for the great work you're all doing. It's so appreciated. Thank you so much.
Thank you.
Take care. Be safe. Be safe.
Thank you, Dr. Martin.
Thank you. Thank you, Dr. Martin, for inviting me.
Thank you. I like the promotion. Everybody's promote me to Dr. Martin. I'm
That's
not
what I was
smart.
about to,
I'm not smart enough to be a doctor.
I was about to ask.
Take care.
Professor Martin, you have to be safe.
You too. Be safe.
Be safe, everyone.
Thank you, Katrina. We'll talk.
Sounds good.
Thank you.
Thank you, everybody. Take care.